How do you feel about pain and suffering? How would you feel if you were suffering with pain because of a health condition, and no matter what you did, the pain and suffering would never go away, and that you knew for the rest of your life your pain would only increase? You know, all of us have probably experienced the loss of a loved one in death. And maybe some of us have even seen our loved ones suffer before they died. As a nurse, I have seen many people die agonizing deaths. And that's why I want to talk to you about this concept of euthanasia. Euthanasia should be a legal procedure that each patient should have the right to choose for themselves if they would want to have this procedure done. I want to help you in this speech to understand three things about euthanasia. I want to help you understand what euthanasia is, why it is not legal in most of the United States and many countries around the world, but also why it should be legal. What is euthanasia? Well, it's defined by Collins English Dictionary as the act of killing someone painlessly, especially to relieve suffering of an incurable disease, also known as mercy killing. It comes from the idea or the Greek word meaning easy death. How's it carried out? Well, primarily when we're talking about active euthanasia, okay, euthanasia is either passive or active. Passive means they hold back a medical treatment like a ventilator, which helps a person to breathe, and they can't breathe on their own without it. So in essence, the old pull the plug, take away the ventilator, and the person will die. That's considered passive euthanasia. That is legal. Active euthanasia is when a doctor will inject into the patient's veins a drug or some form of strong anesthetic that will cause them to die. That's active euthanasia. There's a documented cases where an individual was given a mask that had carbon monoxide feeding into them that they would breathe in, and that caused their death because they had very fragile veins. But whatever the case, what we're talking about is a doctor specifically assisting the patient to kill themselves. Why is it illegal in most states of the United States? Well, it has to do with the principle of non-maleficence, where a person, there is legislation that restrains or restricts people from causing harm to others. You've probably heard of the Hippocratic Oath. The ancient philosopher Hippocrates, he created the concept of non-maleficence, and the oath states, this is what most physicians take to become a physician. It says, in part, to please no one will I prescribe a deadly drug, nor give advice to which may cause his death. So doctors take this oath where they will not cause harm to someone in their practice. So that is one reason why this is an illegal procedure. Also, a major complaint of those who are against euthanasia is the slippery slope concept, where the fear is that if the law is made that allows euthanasia for terminally ill patients, then there may later be other laws that allow euthanasia for people who are not terminally ill, or maybe even for people who don't want the procedure done on them. So that's the slippery slope that many fear. At present, physician-assisted suicide is legal in only one U.S. state, that is the state of Oregon. In 1997, the Oregon Death with Dignity Act was passed, and there are only about 15 countries worldwide who have similar legislation to Oregon. Why should euthanasia be legal? Well, euthanasia provides relief for individuals who are suffering extreme pain and discomfort with a hopelessly incurable form of disease. Some live with extreme pain every day of their life. Those who feel that it is immoral, or that it goes against the code of God to cause another person's death, may really want to consider if that's really the case. In the United States, according to one survey, 75% of U.S. citizens identify themselves as a Christian in the form of Christian denomination. Christians consider the Bible as a guide on questions of morality. There are many cases in the Bible that some consider forms of euthanasia being condoned. Probably most foremost in Genesis 5:24 and Hebrews 11:5, the man Enoch was considered a righteous man about to suffer at the hands of persecutors, had his life cut short by God. 1 Samuel 31 verse 4, King Saul, mortally wounded in battle, requested his own servant to take his life to prevent suffering. The man Job, in the book of Job, begged God to end his suffering by taking him into Sheol, or death. So the idea of seeing death as a relief from suffering is not necessarily an immoral concept. Also, euthanasia allows a person with a degenerative disease to have a sense of peace of mind, knowing that in a future point of time, as their disease gets worse, that they may have as an option this relief available to them. Also, most with degenerative diseases fear more than anything the pain that the suffering they experience causes on their loved ones. To see the faces of their loved ones as they watch them go through this horrible suffering in helplessness. The last point I'd like to point out is patient autonomy. According to an article written by James M. Badger, Ph.D., healthcare professionals have the obligation to educate and advise patients of the best medical options. But, he says, patients always have the right to refuse. See, patients have rights. They have the right to good medical treatment. They have the right to refuse medical treatment. They should have the right to die. In conclusion, euthanasia should be a legal procedure that each patient has the right to choose for themselves. Do me this favor. The next time you have a cold, the next time you're in bed with a fever, a headache, stuffy nose, you feel terrible, think of this. What if you knew you would never feel better again? You knew that for the rest of your life, those symptoms that are making your life miserable will only get worse every day. Ask yourself, would you want to continue to live your life in agony, or would you want to have a choice?